Good morning. Thank you for coming here this morning. My name is Brian Young. I'm the Deputy County Administrator for Ontario County. Joining me this morning for this announcement is Chairman of our Ontario County Board of Supervisors, Jack Marin, our Chairman of our Health and Human Services Committee, Dan Marshall, our Director of Public Health, Mary Beer, the President and CEO of Thompson Health, Mike Stapleton, Dennis Riccio, President of the Eastern Region of the Rochester Regional Health System, representing Clifton Springs Hospital, and also Michael Timon from Finger Lakes Health is also here with us. Our County Attorney, Holly Adams, is joining us, as well as our Director of Emergency Management, Jeff Harloff. As you are all aware, our county, our state, our nation, and the entire world is in the midst of this COVID-19 outbreak. This is an unprecedented situation, but one that will ultimately pass. On Saturday, Ontario County declared a state of emergency in preparation of COVID-19. I'd like to assure residents of Ontario County that we are prepared to manage this health crisis. A collaborative team of professionals, including the men and women that are standing with us here, and many others, have been working tirelessly for the last weeks in anticipation of COVID-19 cases in Ontario County. We have a comprehensive crisis plan in place to respond to cases, and we are furthering these plans to help mitigate and prevent any widespread outbreak of coronavirus in Ontario County. We have been working in collaboration with county leaders, our health systems, the New York State Department of Health, and school district leaders to ensure our public safety. We will continue to work in collaboration with these organizations for as long as it takes until the COVID-19 crisis has passed. All this being said, it is our unfortunate task to inform Ontario County residents that we received word last evening of an individual in our county that has tested positive for COVID-19. I will turn it over to Public Health Director Mary Beer to provide the details on the case. We will do our best to answer your questions, and please keep in mind we would like to respect the privacy and protect the privacy and confidentiality of this individual. Mary?
Thank you, Brian. Last evening at 6 o'clock, I received a phone call from our state epidemiologist that we had our first positive COVID-19 case. This individual was already known to us because we had the individual under preliminary quarantine, and this individual had been cooperating fully. So this individual, as well as her spouse, are now currently under mandatory quarantine by order of myself, and we will be monitoring this situation. We also sent a nurse out last night to interview the individual to find out where the individual had been prior to being quarantined, to make sure we had the contact information to see if there was an expansion of who we needed to quarantine, and we're still working on that process. The individual lives in Victor and does work at the Friendly Home. That information was sent out last night from Monroe County. Monroe County will be dealing with the Friendly Home because that is their jurisdiction. We are dealing with any residents within our county. The individual is doing well. Symptoms are getting better, was not hospitalized, although did seek care at a couple of our facilities in the county, and we've been in touch with those facilities to make sure that there's no challenges there. She was the individual at the facilities, they did wear protective gear so that we feel things are safe at those organizations right now. The resident came back from Florida, had been at a conference down there, and believes that they contracted it there because there was an individual who was sick. Again, individual did not require hospitalization and is recovering well. So that's really about what I have to say. Chairman Marin?
Thank you, Brian and Mary, and again, good morning, everyone. So this past Saturday, as mentioned by Mr. Young, we convened with the 9 school districts, spoke to the school superintendents, and certainly was in the best interest of the students and certainly their well-being was to the cancellations of schools. Today is a conference day being held by all 9 school districts. Tomorrow's half-day scheduled for all 9 of our school districts, and commencing after that, they would be closed up until April the 13th. At that time, certainly depending on where this virus takes us, we have the right, again, under the declaration of county law, to extend or renew that extension. But right now, schools will be closed until the return of the spring break on April the 13th. In addition, throughout the county, our sheriff has curtailed the visitation to our jail, visitation for the inmates. I know that's certainly a hardship for the individuals and families who want to visit their loved ones, but it's necessary to protect the inmates that are in our jail system. Our county clerk notified me this morning that effective today is going to close our motor vehicle department in Geneva only. The main office here in Canandaigua will continue to operate at this time. Again, this is uncharted waters for all counties, state governments, city, towns, and villages, and certainly there's no playbook that we are following. This will be a live document that will certainly be changing on the fly what we feel is going to be in the best interest of certainly our county employees and certainly the residents of our county. At this time, I guess we could certainly open up, Brian, to questions from the media. Again, we have medical staff here as well.
What is the age group of the 2 individuals that are being quarantined?
They're in their 50s, less than 60 years old. I'm not going to give you identifying information. It is important that we keep these individuals' private information.
Can we confirm it's a woman?
It is a woman and her husband who are quarantined.
Can you tell us where her husband works? Or where
No, I do not know that, actually.
You don't know where the husband works?
I do not personally know that. I know we got that information, and he was going to call into work and tell them they cannot be in work for the next 14 days.
Can you kind of walk us through the process of just tracking down where folks have been, you know, especially in a case like
Right.
this? Complications maybe.
Right. So we, in this particular case, we were notified when the individual went to the urgent care that we had a potential case, and so then we opened up a case and we spoke with them after they went home, and gave them instructions on how to quarantine. We then received notice last night that I received a phone call from the state epidemiologist, and they get the information directly from the lab. And so then once they called me, then we sent the nurse out to do the contact information and gather all the clinical information and identify, and then we work with the state epidemiologist in terms of, are there any contacts that need to be investigated and further quarantined?
Have you done that yet? Have there been any?
We're still in the process of doing that. We have a lot of information we're working with right now.
So the urgent care was what day?
I'm sorry?
The urgent care was which day?
Friday.
Friday.
Thank
so
you.
when did this individual come back from Miami?
Like 4 days prior to that.
So that would be...
Around the 8th, I think. I'm going off of memory.
Yeah. And then the symptoms were concordant with, starting to see it increase, it even worsen.
Correct.
Are there any people, I'm sorry, are there any people in the nursing home with any symptoms?
This individual does not work directly with patients there, but that's a question for them. It's not my investigation in Monroe County, so.
So what extent do you think this, or what do you think this means for local contamination? Do you think you're better situated to isolate this problem because it's a rural community?
It's going to be here. We are already quarantining individuals preliminarily, and then we have a few cases. So is it going to be worse? We're going to get hit just like the rest of the country. But we're trying to mitigate. We're trying to be on top of it. Our healthcare, our systems are working very hard to stay on top of it.
Do you know how many individuals are in that preliminary quarantine?
Just a handful.
Okay. Is that like less than 10?
It's less than 10.
Okay.
Mary, you mentioned that you were going to reach out to the husband's work, but then before that you said you don't know where the husband works. Do you
No,
have
I
any-
don't personally know. My nurse knows. She spoke with him, and he was directly contacting his own employer.
So is that information going to be released, just so other people are aware, or are those employees at his workforce going to be notified so they could see if they came into contact?
I don't know. That's part of the investigation that's going on right now. This is a very early, we just wanted to get the message out there, but we're still investigating the case.
So contact tracing?
Yes, yep. And working with the state with that. So we're not doing that alone.
What would you say to the people, this is happening throughout the country, people still going to restaurants, still going to bars and say, I'm going to live my life. We're seeing that all through social media right now, a little bit of almost ignorance in a way to all the facts that health officials are putting out there 24/7. What would you say to them and to the people who want to still celebrate St. Patrick's Day tomorrow?
Don't do it. Definitely, this is a strategy, a public health strategy, to try to slow down the spread of this new virus. We want to do that in order to give our hospital systems the ability to take care of the surge that they're already seeing because of flu. So it's very important that people consider not just themselves. This is, you know, we live in a society, and I would say that it really is time for us all to come together and try to stop this by not just thinking about yourself, but think about your neighbors, your family. How are you going to feel if you got it and gave it to your mother and they passed away? I mean, this is the time not to be selfish.
Do you think it'll get to the point where in the coming days we'll see those, you know, some of those public establishments closed just because of the threat?
I'm not surprised if that would not happen because of what's happening in other parts of our state and other parts of our country.
Have you taken stock of the resources that you have as a county to fight this in your healthcare industry? You know, a lot of people talk about ICU beds, ventilators, and the other resources that local hospitals would have. Have you looked into that?
We've been talking with the hospitals, and I'll let that adjust themselves.
Yeah, what I would say is that...
I'm sorry.
Yeah. Dustin Riccio from Clifton Springs Hospital and Clinic. What I would say is that New York State is doing an excellent job in essentially coordinating all of those resources, and we have a herd survey which goes out, I believe, on a nightly basis to go through exactly what you just described, how many ICU beds, how many other beds are out there, and what are the PPE, the personal protective equipment that each one of the hospitals has.
Speaking of resources, has Albany sent any money to the area just yet, and how much, if any, how much has Ontario County received?
Not yet. We're tracking all of that, and then back to your question too. If you look at what we're doing from a PPE perspective, that is one of the things that's concerning us. And if this does get to the level it potentially could, it's why both of our health systems have canceled elective surgeries. There's no more elective surgeries for at least 2 weeks. We've got very clear who still needs surgery based on what's wrong with them, and it's, you know, anybody that could still have a life-threatening event is going to get their surgery. But we want to save the masks, we want to save the gowns, we want to save the gloves. So we're putting all of these things in place. And really what we're trying to do, and I give the federal government credit, I give our state government credit, I give our local government credit. It's all these containment strategies. That's how we're going to stop this. By keeping people away from each other, keeping people out of the hospital. Our visitor restrictions just changed again. We've had probably 5 different changes in our visitation. There's no visitors. There are no visitors unless it's end of life. If you're on an OB unit, there's 1 visitor. If it's obviously a kid in the hospital, mom or dad can be there, but nobody's coming in because the worst thing that can happen is we get an exposure to our folks and then we don't have people to take care of them. And that's what we're trying to mitigate more than anything else right now.
Real quick, when you say PPE, what do you mean?
So it's the personal protective, it's your gas, it's your mount, it's your mask, your gowns, your eye protection, and the gloves. But we do, you know, we can speak for Dustin, we have enough now, right? But the concern is, what's this look like 2 weeks from now? What's this like 3-4 weeks from now? We got to make sure we were on a call last night with the federal government about the national stockpile of what is still there, what could be available to us if this continues to go, you know, further down. But the point of it too is and you guys I think have done a very good job. This is changing minute by minute, hour by hour. I mean, literally, we're on phone calls, whether it's with the CDC, whether it's the State Department of Health, and it keeps changing, and the calls are at all hours of the night. And so we're going to continue to do that. We are in our community hospitals, but we're also part of the incident commands at our larger health systems. You know, for us, that's an 8 o'clock call every single morning. Then we do it at Thompson at 11 o'clock, and then start getting the information out to everybody.
How reassured did you feel after that conversation or the phone call, I suppose, just when you were talking
about
and what the stop time?
If it got to that point, are there going to be challenges? I would probably say the biggest challenge is probably ventilators. I mean, that's been something that has been addressed over the years and some different things. But as far as getting the gloves, getting the masks, we're going to get what we need to do to take care of people.
And I think that also goes back to the point about our community protecting themselves with the social distancing to help us actually conserve those resources.
Yeah.
That's the critical piece for us right now.
And that's, I mean, this has been going on, you know, let's just say 2 weeks for a round number, but that patient showing up to urgent care followed the directions that they should have done from what they're hearing in the public. She had a mask on from the time she walked in. Nobody was exposed. Was brought down by a local EMS to our ED. Local EMS did exactly what they were supposed to do, followed their protocols, brought in our ED, had a mask on the entire time. Nobody was exposed. Everything is low risk, and then she went home. If we didn't do all the planning and all the preparations going on, she walks into our urgent care with no mask on. She just exposed everybody that she just came in contact with. And so that's why people got to be smart, you know. And you know, we're going to keep following this, and you know, they're still learning so much about this as far as incubation period, so on and so forth. That's what all the epidemiologists can help us figure out at this point.
Speaking of the county school system, whoever mentioned it.
Yes.
Okay, so you half day tomorrow, and then you're closing after that, and then they return on the 13th.
April the 13th, correct.
In between that time, when will the schools, if they'll be contaminated, when will that happen?
What they are going to, all of them are planning to do the rest of this week was deep cleans in all the schools and continuation of that. I know there's certainly, my understanding, I think some of the schools want to certainly have the ability for students to come in, maybe work out, and again, that's up to each school what they're going to do, but deep cleaning is the, they spoke highly of yesterday, or Saturdays.
Where did this woman fly into?
I'm sorry?
Where did this woman fly into?
She flew from Florida to Miami to Rochester.
From Miami to Rochester. So is any precautions being done at the airport?
No, the epidemiologist said that the spread was long enough that we would not be contacting the airport.
And which urgent care was this?
Farmington.
The Farmington, University of Rochester, Thompson Health, excuse me. Well, it's part of it.
Are all the counties working together in this with Dr. Michael Mendoza in Monroe County? I mean, I imagine, you know, Wayne County, other counties who are just unfortunately bracing for impact. Are you guys all working together throughout Western New York?
We absolutely are. We're part of an 8-county rural health network called the Say Rural Health Network. Public health directors get together on a routine basis. We had a call yesterday. We had a call the day before. We have been in touch with each other about what's going on in each other's counties. We do joint policy making, and we've done joint information sharing so that it's a consistent message throughout the region. We also, like Monroe's not part of that network, but I was in contact with Dr. Mendoza last night, and so we do communicate to make sure that we're all on the same page. And the message is the same from all of us. Distance each other and wash those hands.
The state of New York has had coronavirus conference calls at 3 o'clock. I've had accessibility to them for the last 2 weeks. Even on weekends, that continues, certainly sharing information across the board. New York State Association of Counties has certainly been sending out daily memos, you know, next step for us to help guide us through this process. Any other questions for anyone?
Why keep the school open for that one half day?
Again, we have a number of the school superintendents, they talked about students coming in, and maybe some of the parents will just say, you know what, I'm going to come in, but materials, things that they'll need for the next 30 days while they're being homeschooled, essentially. And actually, a number of the elementary schools were putting packets together as well. The big concerns that the school districts also, like certainly Metropolitan, I have to believe the city of Rochester, that was a concern, and actually New York City as well, when it comes to feeding our children, breakfasts and lunch, and going through that process. So they are also, that was part of the process as well with the school superintendents, really coming up with a plan how they were going to continue to provide meals to the students within their school districts.
Do you have a number of students or percentage of students that utilize those services?
I do not, sir.
Do you
How many
have,
quarantined in Ontario County?
What was it?
How many are quarantined right now in Ontario County?
How many what?
Total quarantine.
We have 3 mandatory quarantines and less than a dozen of the preliminary,
So that would be
precautionary.
That would be the wife, the husband, and who's the other one?
We had one other who was a healthcare worker who was exposed up in Monroe to a positive individual.
Is that the person that was exposed at the friendly home?
No.
So what is that person's status?
Pardon?
What is that person's status? Who's
They're asymptomatic and cooperating fully. All of the individuals, I have to say that, you know, people have been coming and going. We haven't been giving out the preliminary quarantines because the numbers change daily. So somebody may go in a preliminary quarantine until we get the test result back. So, you know, it's just a rolling figure. But it has been a small number, but everyone has been very cooperative with my staff.
Who's handling the testing for the county? Is it Erie County or?
Actually, we've been using Wadsworth, Erie County, and now U of R is just up, I believe it's today. And Rochester Regional just came on board as well for their offices. So
Last night's was Wadsworth.
yes, it was. And we're so grateful that the Rochester Regional and the U of R are now up and running so that we can get our results a lot quicker.
that third person under mandatory quarantine, is that person test results back yet? Are the test results back for that person under mandatory quarantine besides the wife and husband?
I don't understand. I'm sorry, I can't hear you.
Is a third person in mandatory quarantine
Yes.
that we just spoke about?
Yes.
Test results back. I know they're asymptomatic, but have they been tested at all or no?
They have been tested, but we have no results yet.
When do we expect those?
Don't know.
How long did it take to get the positive test result back?
I think it took 2 days.
What's the process for Ontario County, or just when it comes to, I know Monroe County was sending their information up to Erie County.
Right. That's because U of R wasn't up and running. They're just getting up and running this week. So.
If you of R up and running now and Rochester Journal up and running, how long do you expect test results to take now?
So the test results that we are getting back now should be back within the day. We are running about 50 per day and ramping that up to probably about 100 per day, hopefully sometime this week. But the turnaround time has gone from, as Mary described it, from 2 days, about 2 days down to essentially a half a day, which helps us out immensely.
And as this, understand too, as this moves and this evolves, it's going to be a priority basis. You know, the patients that are hospitalized, the patients in the ICU, they're the tests that will be run sooner than the person who's home on a self-quarantine asymptomatic. So that will continue to evolve.
Correct.